2020-2021 by conveyance variants of SARS-CoV-2 vaccines by industry. Abdala, technical name CIGB66, is a COVID-19 vaccine developed by the Center for Genetic Engineering and Biotechnology in Cuba. This vaccine candidate, named after a patriotic drama by Cuban independence hero José Martí, is a protein subunit vaccine containing COVID-derived proteins that trigger an immune response. The full results of the clinical trial have not yet been published. This candidate followed a previous one called CIGB 669. The vaccine is one of two Cuba-developed COVID-19 vaccines in Phase 3 trials. On June 22, official Cuban government sources reported that the results of an initial study by the Cuban Center for Genetic Engineering and Biotechnology involving 48,290 participants found the vaccine, administered in 3 doses spaced 2 weeks apart, had a 92.28% efficacy rate at preventing symptomatic COVID-19. The report included a confidence interval of 85.74% to 95.817% without a specified confidence level. Analysis was based on 153 cases of infection, 142 of which were in the placebo group and 11 of which were in the vaccinated group. The measure of efficacy includes the initial strain of SARS-CoV-2 as well as variants that were present in Cuba during the study, including alpha, beta, and gamma strains. The beta variant is now predominant in Cuba and has entered Cuba in January and has helped fuel a rise in COVID cases. As of the 28th of June 2021, Cuba has not yet released detailed information about the vaccine to the WHO or to the general public via a preprint or a scientific article. It is planned to do so after the Cuba Health Agency authorizes the vaccine for emergency use. Venezuela has claimed that it will manufacture the vaccine, but as of May 2, 2021, this claim had not yet materialized. State-owned Espram Bio will manufacture the vaccine, but some arrangements are needed to start production. In April, Nicolas Maduro said that a capacity of 2 million doses per month is hoped to be reached by August or September 2021. In June 2021, Vietnam's Ministry of Health announced that negotiations were ongoing between Cuba and Vietnam for Abdala vaccine production. The Institute of Vaccines and Medical Biologicals was named as the focal point for receiving technology transfer. In July 2020, CIGB 66 commenced Phase 1/2 clinical trials. The Phase 3 trial compares 3 doses of the vaccine administered at 0, 14 and 28 days against a placebo, with the primary outcome measuring the proportion of cases reported for each group 14 days after the third dose. The trial was registered on the 18th of March 2021. The first dose was administered on the 22nd of March and by April 4, the 48,000 participants had received their first dose, and second doses started being administered from April 5. Third doses have started being administered on the 19th of April and on May 1. Adherence to the 3-dose protocol was over 97%. 124,000 people aged 19 to 80 received 3 doses of the vaccine as part of an intervention study, with the primary outcome measuring the proportion of cases and deaths for the vaccinated compared to the unvaccinated population. A wider intervention study with the 1.7 million inhabitants of Havana is expected to start in May, with the Abdala and Soberna 2 vaccine. Note: while there has been a mass inoculation campaign in Cuba under an observational study, no formal emergency authorization has been given as of the 9th of July 2021. On the 24th of June 2021, Vice President of Venezuela Delcy Rodriguez announced that Venezuela had signed a contract for 12 million doses of the vaccine, and that these doses are to arrive in the coming months. The first shipment of Abdala arrived in Venezuela the day following this announcement.